A lot of people have been asking me about what tests I had to do. So I just wanted to kind of go through. These are my sheets of the tests that I had to do right when I got diagnosed. So I got diagnosed in February, like the end of February, because it was a week before my reading week. So I just remember being in school and being like, no one's gonna even notice I'm gone for like at least 2 weeks, because the first week they'll probably just think I'm skipping the class, and then the second week is reading week. So then the week we get back, they'll finally figure out that I'm gone. But anyways, so this is my sheet of all my appointments that I had to do. So the first week that I got home from school, this is what I had to do. It was really quick. So I had to do, on March 7th, I had to do a bone marrow biopsy and a gallium scan. But I did end up switching the appointments around, so I kind of switched them because the bone marrow biopsy was going to be really painful, which it was, so I'm glad I switched them around. And then on March 8th, I did an echocardiogram and a pulmonary functions test, and then, which are the heart and lungs tests. So they just need to make sure you're okay for chemo. And then I had a CT scan on March 10th, which is up here at 7:45 a.m. And then I had my nurse practitioner appointment on March 15th. So the nurse practitioner is the person that works alongside your oncologist, and they're really smart and they answer all your questions. They're basically the person that you see before you see your oncologist, which I did see my nurse practitioner every time I went for blood work. I would see her first, and then I would see the doctor for a checkup. You only see your doctor the day before your treatment, so you don't see them after your treatment until the week after, when you're going for blood work again. So when you're first diagnosed, my nurse practitioner was in the room with me and was kind of the one that confirmed that it was lymphoma, and then the doctor came in and kind of discussed it further with me. So anyways, that was on March 15th, I believe, that was my appointment to tell me that I needed to go through with treatments, and the doctor came in and explained to me why they were doing it, what's the risk, what are the side effects, and things like that. So my first chemo, as it says right here, was March 21st at 10:30 a.m. and I had a follow-up with my doctor on April 4th, and then my chemo treatment followed that appointment with my doctor the next day at 10 a.m. on April 5th. So, and then I also got a referral, as it says at the bottom, I don't know if you saw it, a referral to another hospital in Toronto, just because if I needed radiation, I would need her to confirm it and to explain to me what would go on and the side effects of radiation treatment. So right here, there was a chemo education class Thursday, March 17th. So a few days before my first chemo treatment, I went to an information session on chemo. So it really helped because they gave you a whole, I know I have it somewhere, so I can show you later. Magic. I found it. So here's a little overview. And so this is like really long. Supporting you through chemotherapy. There's just this one lady that does like a little PowerPoint, and then if you have any questions, you can ask. So she goes through what is chemo, why people use chemo, how long treatment is, just basically things what to expect, like explaining why they're going to be doing this treatment on you, like how a lot of people go through it, so it is proven to put you into remission. Side effects and ways of coping with your side effects, and also just with the emotional issues that go along with treatment. I'll go through all this in another video. I'll go through like page by page what we talked about, how long the side effects last for, Talking about the white blood cell count because that's really important when it comes to chemo. How to prevent infections, because fevers really tell you when your white blood cell count's too low and an infection might be forming. So how you prevent those infections from happening. Make sure you take your temperature at least twice a day. I did it like 5 times a day because I was always nervous about it because I had a few incidences where I had to be in the hospital for it, as I've mentioned before. I'm talking about nausea and vomiting, which is just lovely. Make sure you drink lots of water. That's key. And don't drink smoothies while you're in chemo. That's not a good idea. Learned that the hard way. And don't eat spaghetti the night after chemo also. You may think you're feeling okay, but once it goes down, it's coming back up. So, yeah. Talking about mouth sores, which is huge because you have to prevent them. Okay, in my next video, I'm going to be talking about how to prevent all this stuff. Do this stuff before the signs actually start happening, because my problem was that I would get mouth sores, but I did nothing to prevent them, so I didn't use the mouthwashes because I was like, oh, I don't have them, so I'll wait until I have them to use them. No, do it right away. Some digestive issues. You can get constipated or you can get diarrhea with chemo, depending on your type of chemo and how you react to it. And then also talking about hair loss, which is a side effect, obviously. And talking about who is part of your cancer team kind of things. For example, your oncologists and your social workers and your nutritionist and the people that give you the drugs, who are lifesavers. And then it goes through step by step. I'll show you this one because I told you this one a few weeks in my last video. What happens when I come into the clinic to receive treatment? Step by step what I told you. Okay, you register with the clerk, you have your blood work done, that's the first day, and you complete a little survey. So you like go on the computer, you have your own little login. It's a scale from 1 to 10. So if it asks like how your well-being is, like 1 is the lowest and 10 is the highest. No, it's the opposite. 1 is the highest well-being and 10 is the lowest. I think that's how it works. Wow, after all that time, I can't remember. Anyways, I still have to do it every time I go, every 3 months. I still have to fill out that little survey, so just to make sure the side effects are going away as the years go on. Yeah, I said years because it's going to be years. Assessment by a nurse, which is your nurse practitioner, like I told you, and then see your oncologist, and then receive your chemo treatment. Yeah, that's what I mentioned. And that's the end. Oh, and then we did questions and discussion. There's a little reference there. National Cancer Institute. I guess there's a book on it by a cancer institute. So yeah, back to the video. But anyways, I got a whole information packet that really helped. I never looked at it again, but I made a few notes just to kind of help. You know, it told you, the person was really helpful and she told us what to expect. And I met a really nice lady there who was there with her husband, and I was with my parents, and we talked a little bit because we were both really scared and didn't know what to expect. She was probably in her 50s, and just seeing somebody like much older than me and that scared, it reassured me that we're all in this together and that nobody's alone, and those feelings that you have inside are normal. And so if you ever need somebody to reach out to, like, there's those people that you meet in the chemo suite, like, they're all feeling the same way. They're all not excited to be there, and they'd rather be, you know, doing other things than getting chemo treatment, obviously.